The overlooked health crisis. Women's healthcare challenges. In prisons and jails, incarcerated women face a myriad of health challenges, both during their time in jail and upon re-entry into society. A 2014 study titled Health Priorities Among Women recently released from jail sheds light on these challenges and offers valuable insights into the health priorities of these women. Incarcerated women face a multitude of health challenges that are often more severe than those experienced by their male counterparts. These challenges encompass physical health issues, mental health disorders, substance use disorders, and reproductive health concerns. The 2024 Women's Mass Incarceration Prison Policy Initiative report has considerably updated public data regarding the status of women's health and healthcare in prison and was able to draw direct and clear lines between incarceration and a negative impact of women's health in 4 key areas that lead directly to finding and funding community-based solutions that benefit women who are leaving prison or jail. In re-entry programs. Physical health. A significant proportion of incarcerated women report physical health problems. Approximately 50% have disabilities, and many enter the correctional system with existing medical conditions. The prevalence of chronic illnesses such as hypertension, diabetes, and asthma is notably high among this population. Additionally, infectious diseases, including HIV and hepatitis C, are more common among incarcerated women compared to the general population. The physical healthcare standards for women in prisons or jails are shaped by a range of systemic and structural factors, from policy frameworks to funding limitations and the availability of specialized staff. Federal and state laws, such as the Eighth Amendment's prohibition of cruel and unusual punishment, mandate a baseline standard of medical care. However, the interpretation and implementation of these requirements vary widely across jurisdictions, often influenced by budgetary constraints and resource availability. While organizations like the National Commission on Correctional Healthcare, NCCHC, provide guidelines, adherence is typically voluntary unless enforced by specific policies or legal rulings. Funding shortfalls exacerbate these challenges, limiting access to diagnostic tools, medications, and preventive care services. Chronic illnesses such as diabetes and hypertension are prevalent among incarcerated women. Yet preventive screenings and ongoing management are frequently underfunded. Compounding this issue, correctional facilities often face shortages of medical staff who are trained to address the unique health needs of women, including reproductive care and the treatment of conditions linked to trauma or substance use disorders. Furthermore, inadequate infrastructure, overcrowding, and sanitation issues create environments that worsen existing health conditions. Addressing these gaps requires a multifaceted approach, including mandatory adherence to evidence-based standards, increased funding for preventive care, and the implementation of integrated, trauma-informed care models to improve outcomes for incarcerated women. Mental health disorders are prevalent among incarcerated women and men. But women's mental health is exacerbated by incarceration because they are often the primary caretakers for children or family members. According to the Marshall Project, over 3/4, 76%, have indications of past or current mental health problems, a rate significantly higher than that of incarcerated men. Conditions such as depression, anxiety, post-traumatic stress disorder, PTSD, and serious psychological distress are common. The incarceration experience itself can exacerbate these mental health issues, leading to a cycle of deteriorating mental well-being. The mental health treatment standards for women in prison or jail are deeply shaped by systemic, social, and institutional barriers that hinder access to adequate care. Women in correctional settings experience disproportionately high rates of mental health disorders, including depression, anxiety, PTSD, and serious psychological distress, often stemming from histories of trauma, abuse, and poverty. Despite the urgent need for treatment, many facilities lack sufficient resources to meet the overwhelming demand, leaving significant numbers of women untreated or inadequately cared for. Compounding this issue is the absence of trauma-informed practices, which can lead to re-traumatization when prison environments or disciplinary actions replicate aspects of past abuse. Structural challenges further exacerbate these issues. Prisons and jails often face shortages of qualified mental health professionals, and staff are frequently untrained in gender-responsive and trauma-sensitive approaches. Limited funding and policies prioritizing immediate security concerns over comprehensive care reduce access to therapy, medication, and crisis intervention services. Stigma surrounding mental illness and systemic biases also deter women, particularly women of color and LGBTQ+ individuals, from seeking help. Additionally, overcrowding, separation from families, and punitive disciplinary measures create stressful environments that intensify mental health struggles. Upon release, barriers to continuity of care, such as lack of insurance and poorly coordinated reentry programs, often result in untreated conditions and higher risks of relapse. Addressing these challenges requires trauma-informed care, increased funding, gender-specific programming, and robust reentry support systems to improve outcomes and reduce recidivism. Substance use disorders are a critical concern among incarcerated women. More than half, 58%, met the criteria for a substance use disorder in the year prior to their incarceration. The lack of adequate treatment programs within correctional facilities often means that these disorders remain unaddressed, increasing the risk of relapse and recidivism upon release. The treatment standards for women with substance use disorders in prisons and jails are shaped by systemic, social, and institutional factors that often hinder access to comprehensive care. Women entering correctional facilities frequently have high rates of substance use disorders, many of which stem from coping with trauma, abuse, or mental health challenges. Over half meet the criteria for a substance use disorder, and co-occurring mental health issues are common, necessitating integrated treatment models. However, such holistic programs are rare, leaving many women's needs unmet. Additionally, most existing programs are designed with men's patterns of substance use in mind, failing to address gender-specific factors such as trauma histories, relationship challenges, and the needs of pregnant or parenting women. Access to evidence-based treatments such as medications for opioid use disorder, MOUD, and cognitive behavioral therapy, CBT, remains limited for women in many facilities. Funding shortfalls, stigma, and systemic biases further exacerbate these challenges, particularly for women of color and LGBTQ+ individuals. Upon release, barriers such as lack of insurance and affordable treatment options often interrupt continuity of care, increasing the risk of relapse. To address these gaps, correctional systems must expand access to MOUD, implement trauma-informed and gender-responsive care models, and invest in reentry programs that connect women to community-based treatment. By addressing these systemic barriers, we can improve outcomes for incarcerated women with substance use disorders, reduce recidivism, and support long-term recovery. Reproductive health care in correctional settings is frequently inadequate. Women often face challenges in accessing necessary gynecological services, prenatal and postpartum care, and menstrual hygiene products. The lack of comprehensive reproductive health services can lead to untreated conditions and complications. The treatment standards for women's reproductive health in prison or jail are influenced by systemic underfunding, lack of gender-responsive care, and limited access to necessary resources. Incarcerated women often face inadequate care for critical aspects of reproductive health, including menstruation, contraception, pregnancy, and menopause. Many facilities fail to provide consistent access to gynecological services, leading to untreated conditions such as fibroids, endometriosis, or sexually transmitted infections, STIs. Additionally, menstrual hygiene products are often insufficient or distributed as a privilege rather than a basic necessity, creating unnecessary stress and health risks. Stage-of-life events such as pregnancy and menopause further complicate the healthcare landscape for incarcerated women. Pregnant women frequently receive inadequate prenatal care, and many facilities lack policies to ensure proper nutrition, mental health support, or access to safe childbirth practices. Postpartum care is also frequently overlooked, leaving women vulnerable to complications. For older women experiencing menopause, the lack of specialized care for symptoms such as hormonal changes and osteoporosis reflects a broader neglect of age-related health issues. These gaps in care are compounded by funding limitations, staff shortages, and systemic bias, which deprioritize women's health needs in a system historically designed for men. Addressing these disparities requires implementing gender-specific health policies, expanding access to reproductive health services, and ensuring that women receive appropriate care throughout all stages of life. Healthcare access post-release. Upon release, women often encounter significant barriers to accessing healthcare, including lack of health insurance, financial constraints, and competing priorities such as securing housing and employment. These barriers can lead to unmet health needs and exacerbate existing conditions, underscoring the necessity for integrated reentry programs that address health alongside other critical needs. After being released from prison or jail, women face a range of healthcare needs that require immediate and sustained attention to ensure successful reintegration into society. Physical health needs often include management of chronic conditions such as hypertension, diabetes, and untreated infections that may have worsened during incarceration. Reproductive health is another critical area, with many women requiring access to gynecological care, prenatal or postpartum services, and contraception. For older women, menopause-related care, including treatment for osteoporosis or hormonal changes, is often necessary. Mental health care is equally vital, as many women grapple with conditions like depression, anxiety, PTSD, and substance use disorders, often exacerbated by the stress of incarceration and the challenges of reentry. Access to substance abuse treatment is particularly important, as many women leaving prison or jail have histories of addiction. Continuity of care for medications like methadone or buprenorphine, as well as therapy and support groups, can help reduce the risk of relapse. Additionally, addressing social determinants of health, such as housing, employment, and access to healthy food, plays a significant role in stabilizing women's overall well-being. Navigating these needs is often complicated by systemic barriers, including lack of health insurance, stigma, and limited access to affordable community-based healthcare services. Comprehensive reentry programs that integrate medical, mental health, and social support services are essential to address these challenges and improve health outcomes for women post-incarceration. Recommendations to improve the health outcomes of incarcerated and formerly incarcerated women. The following measures are recommended: comprehensive health screenings, implement thorough health assessments upon intake to identify and address physical and mental health needs promptly. Gender-specific health services, develop and provide healthcare services tailored to the unique needs of women, including reproductive health care, mental health support, and substance use treatment. Continuity of care, establish programs that ensure continuity of care post-release, including assistance with health insurance enrollment and connection to community health services. Trauma-informed care, train correctional healthcare providers in trauma-informed care practices to better support women who have experienced trauma. Policy reforms, advocate for policies that improve healthcare access and quality for incarcerated women, such as eliminating Medicaid suspension during incarceration and ensuring access to necessary health services. Integrated reentry programs, develop programs that simultaneously address housing, employment, and health needs, recognizing the interconnected nature of these challenges. Healthcare navigation services provide assistance in enrolling in health insurance programs and connecting with healthcare providers to ensure continuous care post-release. Mental health and substance use support offer accessible mental health services and substance use treatment tailored to the unique experiences of formerly incarcerated women. Community partnerships collaborate with community organizations to create a supportive network that facilitates successful reintegration and promotes overall well-being. Policy advocacy, advocate for policies that remove barriers to healthcare access for formerly incarcerated individuals, such as eliminating Medicaid suspension during incarceration. By implementing these recommendations, we can work towards a more equitable and supportive system that prioritizes the health and well-being of women re-entering society after incarceration.